Hi, my name is Barbara Dipietro. I'm the Policy Director for the National Healthcare for the Homeless Council and also the Policy Director for the Healthcare for the Homeless of Maryland. And I wanted to talk to you today about single payer and particularly about where we need to go from here. One of the things that we think about in moving forward is examining where we are. So we come from a place where right now there are 50 million people in America who are uninsured, another 20 million who are underinsured. We have a system that's primarily rooted in employer-sponsored insurance, and we have a system that is fundamentally rooted in a for-profit economic model. When we look at the inconsistencies with healthcare and how that does not tend to mesh with a private market for-profit model, particularly in its just core fundamental utilization in terms of societal functioning, individual need. These are things, principles that just don't seem to be in harmony with one another. They tend to conflict. For example, we tend to have universal education amongst our youth, K through 12 education. That's a public good. Police, fire, libraries, all of those things are public goods. And so why we look at healthcare as something different is curious to me. But we have the Affordable Care Act that we're putting a lot of time and attention on right now. What we're not putting a lot of time on is the shortcomings of the Affordable Care Act. Even after all of the components are implemented, we still have 20 million people that remain uninsured. And it's something that we really need to focus on, is that we're still rooted in a fragmented, siloed system that is fundamentally based on a for-profit model. Even the public systems that are being expanded under the Affordable Care Act are often still for-profit insurance companies. Medicaid managed care organizations are not really much different. And so when we think about what that means in moving forward with the Affordable Care Act, with what we have now, all that I see are still the gaps that remain. And how we're not getting where we need to go with healthcare in this country. When we compare ourselves internationally, we spend twice as much money and we get not the results that we pay for. In fact, we get poorer results than our fellows in Europe in particular. When we look at any other country we'd like to be compared to, we still don't measure up. World Health Organization ranks us as 37 in terms of healthcare systems. That's just unacceptable when it comes to, typically in America, we like to think of ourselves as problem solvers and really tackling these things in an efficient and effective way. We just haven't gotten there yet with regard to healthcare. Right now we have the Supreme Court that is just spent 3 days looking at the Affordable Care Act and whether it will stand in part or in whole. If they should strike this down, I think this gives us another opportunity to really redouble our efforts on focusing on what really the solution needs to be in terms of effective and affordable health care, and that's for everyone, and achieving the outcomes that are possible through a unified, single-payer, privately administered model. And this doesn't mean a takeover of health care. In fact, really, we've already had our health care taken over, but it's not necessarily by the people we say we fear. We've been taken over by a for-profit model that actually puts our own health behind profit margins. And so I think that's the real piece that we need to be focused on. All of the people that are saying, you know, keep government out of my health care, we subsidize employer-sponsored health insurance in this country to the tune of $160 billion a year. That was in 2010 we spent that much money. That's a significant amount of money, and again, thinking about how we might be able to get better outcomes using a single financing mechanism. Now, this doesn't mean that the government has to be the provider of all services. It doesn't even mean that the government is necessarily the one who is delivering that care. When we look at models in Japan, in Europe, Japan, France, Germany, Taiwan, all of these are actually private models. They're not for-profit models, but they compete against one another in their different plans on patient satisfaction, quality of outcome, all of those measures that we say really are important to us. Why is it that we really can't look at those as more viable models for the United States? I think we tend to get held up in the way that Britain and Canada have approached their single-payer system in terms of it is both government financed and government delivered. But there are a number of options that we might explore if we allow the rational conversation to occur. So it's one of the things that I'd really like to focus on as we move forward in our advocacy for single payer. Even if the Affordable Care Act should stand and remain constitutional and move forward to be implemented, let's continue to focus on where we need to go, because the Affordable Care Act is not the end-all be-all, and it's not the panacea that's going to solve the current problems in the system. I think it certainly moves us in a good direction, but it doesn't finish where we need to go. So either way, whether it's struck down or continues to go forward, I think the mandate for us is to continue to focus on the outcomes that we need to have in a rational healthcare system that meets all of our needs. And that clearly is a single payer model. So I encourage you to really be active on this and to use the information that's available. I appreciate your time and your action on this issue. Thank you.